great. Thank you for coming.
Thank you.
It has been 9 days here, and I want to explain a little bit about this case because she was asking me 9 days ago if we were able to do something with this. This is a CT scan on a partially edentulous patient, as you can see here, and we wanted to know what would be like the best solution for those uppers. As you can see on the upper maxilla, there's not much to do. Has been many years without no teeth. The bone density is not as the same as this, and the quality, see the quality, the amount of bone that we have is not like the best. When you work with CT scans, you're able to see in different shapes and in different angles if you're able to work with the amount of bone that you have. So we discussed and we talked about what would be like the best solution on a case like this. There's one step when you have very narrow bone. There was just only like a 2.0 bone on that area. I wanted to see how strong it was. So there's a technique with, obviously, with these narrow implants that I did, and we talked about it, and I want to show the x-ray in a moment to explain the before and explain a little bit the after. We had a patient coming here for a solution on uppers, barely no bone on uppers, on upper maxilla, on lowers. See the receding bone that we have on those two anterior implants that she had, and she didn't have no molars. And we had the inferior alveolar nerve very near from the border, so it was complex to put implants there. It was going to be very complex. We discussed about what would be like the best solution, and I told her, allow me to put narrow implants there and let me do this technique of snapping dentures. I want to open and I want to feel the quality of the bone, because you can have small amount of bone but it's a very hard bone, or you can have too much bone but it's so soft. So we decided to remove these two implants and remove these remaining teeth because we had problems of bone. We had some decay here, some decay, so I decided to extract them. We did IV sedation. It was a nice sleep, no?
Yeah, that's great.
It was a nice sleep. I was able to place 7 of these narrow implants. I wasn't able to do something here because there's no bone there, but I was able to anchor those implants, and on lowers I did the all-on-4. The all-on-4 respecting the inferior alveolar nerve, and this is the result. This is the result. We have a screw-retained bar on lowers with the all-on-4, and we have snapping denture on uppers. So this is the way that I resolved this 9 days ago, and we have something to say. So let's go to the studio. Come with me. After you. Bye. Because they can look beautiful, but what about anchorage? That was the most important.